Hello and welcome. Today we're delving into a rare but devastating neurological disorder, Pelizaeus-Merzbacher disease, or PMD. We'll explore what causes it, how it affects the brain, how it's diagnosed, and what treatments are available. This is a complex condition, so let's break it down together. PMD is primarily caused by mutations in the PLP1 gene. This gene provides instructions for making proteolipid protein 1, or PLP1. PLP1 is a vital gene that makes up myelin. These mutations can be inherited from parents or, less commonly, arise spontaneously. It's important to understand that PMD is a genetic disorder, meaning it's passed down through families. Now, let's understand how these gene mutations manifest in the body. PLP1 is the most abundant protein in myelin. Myelin is the protective sheath that surrounds nerve fibers, like insulation around an electrical wire. It allows for the fast and efficient transmission of nerve impulses throughout the brain and spinal cord. When the PLP1 gene is mutated, the body either produces abnormal PLP1 or doesn't produce enough of it. This leads to improperly formed myelin or a complete lack of myelination, a process called hypomyelination. Without proper myelin, nerve signals are slowed or completely blocked, leading to a variety of neurological problems. Pelizaeus-Merzbacher disease is very rare. It's estimated to affect about 1 in 400,000 births. Because it's a genetic disorder, families with a history of PMD have a higher risk. There is no specific ethnicity or geographical location that is more susceptible to PMD. The signs and symptoms of PMD can vary widely depending on the severity of the mutation. However, some common symptoms include nystagmus, which are involuntary rapid eye movements, hypotonia, or low muscle tone, which can make infants appear floppy. Developmental delays, such as difficulty sitting, crawling, or walking, are also common. As the disease progresses, individuals may develop spasticity, muscle stiffness, intellectual disability, and seizures. Some may even experience problems with speech, swallowing, and breathing. Diagnosing PMD often involves a combination of clinical evaluation, genetic testing, and neuroimaging. A neurologist will assess the individual's symptoms and perform a neurological exam. MRI scans of the brain can reveal abnormalities in the white matter, which is where myelin is found. Genetic testing to identify mutations in the PLP1 gene is crucial for confirming the diagnosis. Sometimes, a brain biopsy might be performed, but this is less common today due to the availability of genetic testing. PMD exists on a spectrum and is often categorized into types based on the severity of symptoms. Classic PMD is the most common and typically involves more severe symptoms, with onset usually in infancy. Conatal PMD represents the most severe form, presenting very early in infancy with profound symptoms and a significantly shortened lifespan. There are also other variations, such as PMD-like disorders which have similar symptoms but are not caused by mutations in the PLP1 gene. These subtypes can help doctors tailor treatment and management strategies. Unfortunately, there is currently no cure for Pelizaeus-Merzbacher disease. Treatment focuses on managing the symptoms and improving the individual's quality of life. Physical therapy can help improve muscle strength and coordination. Occupational therapy can assist with developing daily living skills. Speech therapy can address speech and swallowing difficulties. Medications may be prescribed to manage seizures, spasticity, and other symptoms. Supportive care, including nutritional support and respiratory assistance, may also be necessary. Since PMD is a genetic disorder, there is no way to prevent it from occurring initially. However, genetic counseling is highly recommended for families with a history of PMD who are planning to have children. Genetic testing can help determine if individuals are carriers of the PLP1 gene mutation. This information can help families make informed decisions about family planning, including options like preimplantation genetic diagnosis, a PGD, or prenatal testing. The prognosis for individuals with PMD varies depending on the severity of the disease. Some individuals with milder forms may live into adulthood, while those with more severe forms may have a significantly shorter lifespan. Research is ongoing to better understand PMD and develop new treatments. Gene therapy, which aims to correct the underlying genetic defect, is a promising avenue of research. Other studies are exploring ways to promote myelination and protect nerve cells from damage. While there's still much work to be done, there's hope that future research will lead to more effective treatments and improved outcomes for individuals with PMD.